welcome back to another episode of the Evolve Wellness Experience. Dr. Bill Jensen here. Got another amazing show for you today. If you're into basically getting the healthiest you can possibly be in your life without having really to rely on a lot of prescription medications and everything to get there, I got the doc on the show here for you today. So buckle up. This is going to be a really, really good one, and I hope you enjoy. All right, well, welcome back, everybody. Yeah, so about a month ago, I was listening to a podcast on the way back on a road trip and came across this new company, and I was really fascinated by what they had to offer the public in general. It was really something that I had been thinking about myself, obviously as a chiropractic physician, but I really have no formal training in all these different things that I'm slowly learning about. And so I got going involved with this company called Liv Health, and when I signed up for the program, they put me in contact with my new doctor here, which is Dr. Meighen. And so we have him on the podcast here today, and he's a regenerative medicine physician, and so we're going to get into what that is and some of the protocols and programs that I've been personally going through myself in order to reach my optimal health potential. And man, it's going to be an awesome show. So welcome to the show, Doc.
Hey, thanks, Doc. It's good to be here. I appreciate you having me on.
Absolutely. So tell the listeners, a little bit about you and your background, and you're a regenerative medicine doctor. So what got you interested in that?
Yeah, so my background is I am a physiatrist by training. So basically I do non-operative orthopedics and board certified in that and also in pain medicine. So career started, was trying to solve things with interventional procedures, epidurals, nerve blocks, joint injections, that sort of things with, steroid and some of the other things I've been taught. And downside was I wasn't seeing as many people as I thought improve, and some were actually not progressing and were needing other type interventions, including surgeries. So I started kind of looking and reassessing what I was doing and came upon a program called prolotherapy put on by the American Academy of Orthopedic Medicine, and didn't really know much about it, done a little research, and went to one of their programs and kind of opened my eyes in relation to more of a natural way to kind of heal musculoskeletal type problems and issues. And, it's kind of where regenerative medicine started. So what they typically were using was dextrose, basically the sugar that's in all of our IV fluids. So the D5W or the D5 half normal or any of those sort of things is that. And injected in different concentrations or amounts can be anti-inflammatory at low concentrations for injecting in or around nerves like your median nerve and your carpal tunnel or even into your spine. But in higher concentrations can be inflammatory, where it can set off a cascade of response and pull in cells to basically heal the tissue and kind of get you moving forward. And that kind of moved on to things like platelet-rich plasma or PRP, bone marrow stem cells, fat stem cells, and other options and opportunities to basically try to heal people without needing medication, surgeries, those type of things.
Absolutely. Yeah, guys, it's so fascinating because I actually didn't really realize that prolotherapy was kind of the beginning of it all. I've heard of prolotherapy for many, many years, and I know the process behind that. How long has prolotherapy been around?
It basically got pretty big in the 20s and 30s, kind of really popularized by a couple of docs, Hemwell and Hackett, and Cyriax was the other one, and has kind of gone on from that standpoint. Was not super accepted by the general medical community. In fact, was kind of poo-pooed or frowned upon. Everybody thought it was kind of voodoo medicine and that sort of thing, or snake oil. As time has gone on, these folks were actually very much on the right track. And there has been more and more studies done both on prolotherapy and PRP and and some of the other interventions has actually shown that it is very beneficial. Does it work for everybody? No, but there isn't anything that works for everybody. But it definitely has a role in musculoskeletal care in trying to, enhance recovery and or restoring function, reducing pain control, and reducing the need for opioid pain relievers and a good number of other things that definitely have some pretty profound side effect issues associated with them.
Yeah. I tend to see, like, a lot of times when you have something that's a little bit more holistic or natural approach to things, it definitely does get kind of slung around a little bit by the general orthodox medical community, obviously, because it just doesn't fit into that paradigm, And then, but at the same time, obviously, things that work are things that work. So if it stays around long enough and enough people get a hold of it and try it and have the benefits from it, it's pretty undeniable, obviously, if it's that. And at the same time, though, I do recognize the fact that there's a couple different types of people. There are some people that really want that really fast, instantaneous gratification of pain relief or something where, maybe a corticosteroid is going to be definitely a better option for them, in an acute circumstance. But there's other people that definitely really hate drugs or hate medications or hate things injected into their body that's foreign in nature and are always going to try the more natural approach first. So yeah, like I said, it fits in certain circumstances and with certain different types of populations for sure.
No, I agree. And, the beauty of it and the way I try to manage all my clients or all my patients is they're their own entity. And we try to work within their goals and parameters and come up with solutions and guide them to make that happen. There are certain situations or certain things that either they are doing or they want to do that may not be in their best interest. I will definitely counsel them to that effect. But, if that's a certain direction they want to go, and we have the capability of doing so, then yeah, I agree with you. We're able to do it. And that's where kind of the philosophical thoughts and ideas and those sort of things come up, which is good, I think, in coming up with plans and helping people heal and recover and learn and all those sort of things too. I like to teach as much as I treat. And I think that's as important because I think our patients and clients can be our best advocates and really trying to spread the word and what we're trying to do as well. So
no doubt about it. Best marketing ever is from people that are really good outcomes and are really super happy and satisfied because their word of mouth is going to spread a long, long way. And so
absolutely,
that's key. So regenerative medicine, you spoke about, stem cell PRP, prolotherapy, obviously, as a kind of the foundation of how it got going. Is there other kind of branches within regenerative medicine just besides the injections and such?
Yeah. I mean, I look at it kind of a whole piece of everything. So even looking at optimizing things that I'm working on with yourself and the other folks in Liv Health and some of the other entities I'm involved with, looking at cell health, I think very important from that standpoint, looking at immune function, mitochondrial health, mitochondrial function, movement patterns and things that are very important from that standpoint. And, looking at your background, absolutely kind of the same thing. Hormone optimization, optimal intake of both micro macronutrients, all the pieces associated with that, reducing inflammation, because they all spill over into our musculoskeletal system and or our outcomes that way too. So if you've got, horrible cell health, very low hormone levels, you're not exercising particularly well, and, you've got significant challenges from a mental health standpoint, it's going to be very difficult for you to get a very good response from, me sticking a needle in you on one occasion or maybe two. If we can get some of these other pieces on board where we've got your cell health as optimal as we can get it, we've brought your hormone levels and some of the other things up much more into the optimal area. We've got you moving and exercising and activating certain areas, which will set the tissue down much more readily when we do the procedures and that sort of thing. Your outcomes are going to be so much better. You're going to feel much better about, spending the money to do these type of interventions because the vast majority are not covered by insurance. But it also gives you the empowerment of being able to direct care and do what you want to do, not necessarily being told by some other entity that has no interest in you whatsoever what we're going to do. But my goal is just to try to hit you in all areas, just to try to optimize you all the way around, as opposed to just saying, okay, we're going to stick this in your joint and we're going to be done and you're going to walk away and be perfect. So I try to look at it from a head to toe intervention, as opposed to, hey, you just got a knee problem, or hey, you just got a back problem. We're going to quote unquote fix it with regenerative or restorative interventions and procedures. I kind of come at it more from a comprehensive standpoint.
And that resonates with me too, because obviously in the chiropractic world, when I see people that come in with like, just the obvious stuff like a back pain, they look at it like a back problem, and I definitely look at it like a health problem. They have structural issues. They have movement pattern issues. They have inflammatory issues. Their adipose tissue is way too high. They're loading their spine with 100 pounds extra force. Their dietary habits are inflammatory in nature. Their macronutrients and their vitamin status is subpar for regenerative healing. I mean, so when the short answer to a lot of people when they come in isn't a short answer, because they're like, well, why is my back hurt? I go, well, you can see on the x-ray, what's structurally going on, but there's about 50 other different things that are contributing to this. So I can certainly put you in a better position structurally, but all the other things are things that you're going to have to change in your lifestyle habits and what you're doing as far as dietary, water intake, exercise habits, stress patterns in your life, smoking, like all that stuff. So definitely it's not a silver bullet for a problem, no matter what it is. Correct. When it comes to your health.
Well said. I don't know if you or your listeners have read the book Ending Alzheimer's by Dr. Dale Bredesen, but I use that as an example as to why there's not one magic bullet that tends to cure things. And he goes into that right at the beginning of the book, saying these are why most of the pharmaceutical treatments for Alzheimer's have failed, because everybody just wants that one thing. And he goes into, all facets of treatment, where he says there's at least 30 to 36 different things that you must address to see a significant improvement and or even reverse the condition. And I use that for pretty much anything I'm looking at, whether it be an autoimmune type problem or a musculoskeletal problem or an infectious type problem or any of the other things. I mean, it's going to be multimodal and multifactorial treatment, but it was also multifactorial on kind of what set the stage for you to kind of get in these situations. And it's not a blame thing. It's just a matter of people need to understand that it's not going to turn around in one or two sessions or one or two treatments. It's going to be time and it's going to be intensive in the beginning, at least, for sure. And then once we get things back online, then it'll be hopefully a little bit more focused. But the vast majority of treatment for most of the things that you and I do is about 80 to 85% the same. It's that 10 to 15 to 20% that's germane to that one area, be it a back problem, brain health problem, or cardiovascular problem, that's going to be a little bit different. Mm-hmm. But most of the things are going to be pretty similar as far as really trying to get things back online and get things moving forward.
Right on. Couldn't say it better myself. So, well, let's get into a little bit of some of the different protocols and stuff that you mentioned as far as regenerative medicine. Sure. So, real popular one for sure. I mean, I can't even imagine how many patients have had this procedure done, but PRP, platelet-rich plasma injections, are very, very popular these days. Tell us a little bit about that.
Yeah, so that was kind of the next step up from prolotherapy, and has been used in plastic surgery, dentistry, and a few other areas of medicine probably since the 1970s or 80s to help with wound healing, to help with dry sockets, and some other things too. So basically what it entails, very simple, is a blood draw. So we pull out anywhere from 60 to sometimes 180 cc's of blood. And then we put it in a centrifuge and spin it down to separate the constituents of the blood. And the platelets are usually kind of in the middle. The plasma is on top, the stuff that almost looks like urine or pee when you look at it. And that platelet poor plasma actually has some potential benefits. So it's not junk. So we actually use it. It's actually been shown to be more helpful for muscle injections. So muscle tears, for example, hamstring injury, hamstring tear, that type thing. Platelet poor plasma has actually been shown to be more beneficial than platelet rich plasma. So we found some things that actually help. So we actually keep that and use that. The platelet-rich plasma is in the middle, and then the red blood cells are in the bottom. So we usually get that middle layer and then sometimes that top layer. And then we can inject it into pretty much any tissue available. So there are protocols where we inject it into hair to help with hair growth. There are some that you can do in the face if you've heard of any of the vampire facial procedures that the Kardashians have made very popular. You can do it into pretty much any joint, any tendon, any ligament, any structure there. In certain times, you can put in around nerve to help reduce nerve irritability and some of the other things too. So basically what is happening, so the platelets, when you injure yourself, let's take one step back. When you injure yourself, platelets are kind of the first thing that come in that set off a cascade of healing. So if there's any bleeding, there's any irritability or inflammation, they kind of help to calm that. And then they release certain growth factors and other signaling cells to tell other cells to come in and try to, direct healing. And so what we're doing is we're taking away the step that we're injuring you, and we're putting the platelets where we go. Now, we do tend to use the needle in those tissues to cause a little micro trauma. So if it's a bony area or an area where a tendon or ligament inserts, we will try to kind of jab that after we anesthetize it, of course, to try to cause a little micro trauma, bring in some more blood flow, and kind of accentuate the healing. And then we'll inject it typically under some type of imaging guidance, either ultrasound, similar to the ultrasound you would think of if you're looking at your child or if you have a spouse that's pregnant or any of that sort of thing, or women are pregnant. Same thing, we can look at the musculoskeletal system very well, especially the soft tissues with that, or we'll use X-ray or fluoroscopy for certain structures, including joints, but primarily if we're doing spinal interventions, it's definitely necessary to do those type of things. And then you just target that with where you're going, document what you're doing, whether it's into the joints, into the ligament, tendon, muscle. We can do it into the disc. We could do it pretty much anywhere that you can get a needle in. And then, it sets off the cascade of inflammation healing. Now, what I usually tell people is it's very inflammatory, meaning it tends to make things swell, makes things irritated, it makes things sore, painful, uncomfortable. I usually tell them for the first 24 to 36 hours, they are going to hate me and probably cuss my name a couple times, because it's going to be difficult for them to move a little bit, sleep, those type of things. We do tend to give pain medicines, but we try to have people avoid anti-inflammatories and steroids and those sort of things, because again, we're trying to promote inflammation. If we use those things, it's basically wasting your money. Next day, after 24 hours, usually it's much better. Still sore, but you're usually a little bit better. By about the third day, most people know they've had something done, but they're able to get back to most activities, if not all. And, if it's something we did on a Friday, by the time Monday comes around, unless you're a high skilled laborer or somebody that has to do pretty significant heavy duty work, you can get back to work without much of an issue, which is the beauty. Because we can kind of incorporate these into plans where you don't have to miss work and be out for long periods of time and that sort of thing too. Mm-hmm. I know that was a long answer to a short question.
No, that was really, that avoided about 3 other questions actually that I was going to have for follow up, as far as like whether they were guided or not under ultrasound or fluoroscopy. Obviously, I was thinking about the spines and in the fluoroscopy world and stuff like that as well. But and then timeframes, obviously, on a level of benefit from the injection, what time frame can they look? Is it a week, 2 weeks, month?
Yeah, so I usually tell folks that it tends to get better the further you get away from the injection. So most people have had some type of procedure done, some type of steroid procedure, the vast majority. And usually they have undergone, and you get that immediate gratification either with the anesthetic agent, and then the steroid kicks in within couple days to a couple weeks. You feel good for probably about 4 to 6 weeks, and then it wears off. Usually this tends to get better the further you get away from the intervention. So 1 month is better than when you did it, 3 is better than 1, 6 is better than 3, and so on. So it depends on the person. So I've had it done multiple areas, my knee a couple times, because I've had some prior injuries dating back to when I was a teenager. And it took about 4 to 6 months for it to really start showing benefit. Doesn't necessarily mean it will be like that for everybody. And there are instances where we will actually repeat it to try to get even more of a response to move it forward. Sometimes along with that, we'll even do a little prolotherapy, a little dextrose therapy for the same thing, just to try to accentuate the healing. Sometimes we'll even use the hyaluronic acid type injections, or kind of the some note of them as the rooster comb type injections, and those sort of things that also can help to benefit the joint itself and the joint environment, but also have been shown in addition with the PRP to be more beneficial than either one apart. Mm-hmm. So sometimes we will incorporate those type things, and insurances for the most part still tend to cover those. But yeah, I mean, it's variable in everybody. I mean, if you're younger, you tend to heal more quickly. You're going to probably have a much quicker response. If it's more of an acute injury, you injured your ankle 2 weeks ago and we start treatment immediately, you're going to have a quicker response. If it's something that's been there 10 years, it's going to be a little bit longer process. And again, we may have to do it 2 or 3 times to really start seeing a benefit. For example, bad ankle sprain that you've had for a long period of time. Mm-hmm. It's going to take some time for that to really kick in and get going as far as that goes. And that's where we might look at something more robust, like your bone marrow or something else.
Got it. What intervals would you do if you had a chronic one for 10 plus years and you got to do multiple? Would you do it at intervals like every 3 months or so, or how often?
I mean, I think it depends on the person and their ability as well, and kind of what they have going on in life too. But yeah, I mean, you could do it as frequently. I mean, there were certain protocols in the beginning where people were doing it weekly. Okay. It's probably a little bit too much, in my opinion, just because you're not given, in my thought process, a full amount of time to really kind of kick in. But I would say you could probably do it monthly without much of an issue or much of a problem. But yeah, I mean, every 3 months is not unreasonable. Every 6 months is not unreasonable. I think it's a conversation to have with your client or with your patient, mm-hmm. and come up with a game plan and kind of what their thoughts are. I mean, some people just want to walk better. One may be enough to make that happen. Some people want to, I want to get back to doing marathons, or I want to do triathlons again because I can't because of this quote unquote whatever joint it is. Mm-hmm. So those people, that may take a little bit longer. Or may be more aggressive. We may say, okay, let's do it every 2 weeks, or I may try to discuss a little bit more robust procedure.
Right on. Okay. So PRPs, those are kind of the foundational stuff as in this generation now.
Correct.
Step up from that, then stem cell. I mean, boy, oh boy. I mean, you hear so much about stem cell. Like every time you see a high-end athlete that gets injured, they fly to Europe and they get stem cell, injections over there, or quote unquote, But then I also hear at the same time people getting some stem cell procedures over here. So is there a difference between the two of these?
Not a great deal at this stage. I mean, with the caveat that there are certain limitations or restrictions that has been placed on us by, the FDA and some of the other things too. Most of these cells typically have to come from the person. We cannot technically use anything that's called an allograft, where it comes from someone else at this stage. Now, some of those things we can use outside the U.S. without much of an issue, and that's potentially where people are going outside the U.S. to get those done. And then the other thing is fat is able to be used in the U.S. if you do what's called minimal manipulation, meaning you can't break it down and do a good number of the other things to it before you inject it back in. So there are some approved ways to use fat, but there are also ways that you can digest and break it down and release more of the growth factors and or more of the stem cells that you technically cannot do here in the US, that some folks are probably doing offsite, be it Europe or be it in some of the other countries that have less stringent rules and those sort of things too. Mm-hmm. But I would say here we can use bone marrow pretty readily. So basically we stick a needle or a trocar into the iliac crest or the pelvis, and we extract it that way. And then
that must suck.
Overall, it tends to go much better than most people think it goes. There's some degree as the procedure is more uncomfortable than doing the extraction, to believe it or not. But it's not a fun thing. I'm not going to say we get Christmas cards from that as far as that goes, but it usually goes relatively smoothly, and there are options for spinning it, similar to what you do with PRP, and there are options for not spinning it, and there's pros and cons to both. but they can be used either way. And then similar to what we talked about with PRP, you use imaging guidance to direct it to the tissue that you are trying to treat. And sometimes we will do bone marrow and or fat in combination with PRP. So a common one would be a knee. So we would do the bone marrow primarily for the joint and maybe some of the supporting structures if we have enough volume, but we may not. So that's where we do the PRP, where we would hit things like the medial and lateral collateral ligaments on the side of your knee to help improve support or stability. We would hit the meniscus or the cartilage if there are some issues there. We would hit some of the areas around your patella or kneecap. We would hit the tendons. We would hit some of the other structures that may be helpful. Because a lot of these problems arise as the result of instability in certain tissues in certain areas. So we're trying to reinvigorate that tissue, trying to tighten it up a little bit so the instability is much less, which would allow the joint to take a lot less pounding and some of the other things too. So we oftentimes will do those in combination if we have the ability, because they work in different ways, different manners. Certain ways we understand, certain ways we probably don't quite yet, but they can work synergistically, whereas one can be good. If you use 2 or 3 different ones, it's even more robust from that standpoint.
Like I know with stem cell, obviously the name of the game is regenerative. I've heard actually in studies, I'm not 100% it's true. If in a petri dish they put 2 tendons not connected together and then put stem cells in there and the tendon actually reunited like in the petri dish, is that even like possible? Have you heard of anything like that, or is that?
Yeah, I mean there's studies where they've done rats and or rabbits and certain other things, and they've done interventions where they've actually grown nerve and they've caused them to have spinal cord injuries and have seen recovery of function to the lower extremities if they did one in the thoracic or lumbar region. And I think that is going to come to fruition. To some degree already is, but again it's a matter of trying to get these things quickly or acutely where I think you can intervene and really make a pretty profound impact, whereas if it's an older or chronic, or that's not a word, chronic type issue, then it may take some more time for that to really work, or you may not get it again as a robust response. But yes, in answer to your question, there is definitely options to make that happen.
What about a degenerative disc? Is there any benefit to injecting into the intradiscal space and trying to regenerate some of the tissue?
So spine is kind of one of my areas of expertise, and yes, I mean it kind of started the same way as with some of the other soft tissues and or joints. Is people initially were using things like dextrose solutions into the disc to try to help, and then there was a substance called chymopapane that they used to do, which the goal was to try to change the environment of the disc for the better. The downside is there were a couple cases where people had some of the solution leak out onto some of the nerve roots, and the nerve roots were injured to the point where people were either paralyzed or had significant neurological deficits. So they kind of frowned upon that moving forward. But then, yes, I mean, platelet-rich plasma injections into the disc definitely can be of benefit. One of the downsides to that, if you've got a big tear in the disc or significant degeneration where you've got multiple areas where the fluid could leak, that one could come out just because it's a little viscous, but not really viscous. Mm-hmm. Bone marrow actually works very well for that reason, because it's got a little bit more viscosity to it, and it can kind of fill up the little nooks and crannies in some of those holes, as well as changing the environment of the disc and some of the other things. And there's actually a new FDA approved product called ViaDisc, which is made out of the nucleus pulposus, so the inside part of the disc, from cadavers. And obviously they've run through all of the gamut of things, making sure that there isn't going to be any issues with infection or problems from that standpoint. And have just started using that, have done a couple of cases, have not had any follow-ups quite yet. But once I do, I can definitely give you an update from that standpoint. But the beauty of this is I do think it opens us up for more involved treatment for the spine, short of, we start off, and I do these as well, so I'm not, negative negatively looking at them, but usually we'll start off with an anti-inflammatory. We'll start with some physical therapy, maybe some chiropractic or a combination of both. If that doesn't work, then we'll do an epidural or nerve block or a facet injection or any of those sort of things. If that doesn't work, then it's surgery. And if that isn't great, then we're looking at spinal cord stimulation, opioid pain relievers and some of the other things.
Right.
Whereas I think the regenerative piece definitely doesn't burn any bridges for us, but also has the potential opportunity of improving stability, stimulating the nerve as well, but also the muscle to kind of grow, but also improving the integrity of the disc, improving the environment of all these areas, and kind of instigating a restorative type response. That way we kind of break that cycle of all the things that I just talked about.
Yeah, no, that's the holy grail right there. If you can, reverse time basically and the damage that got accumulated over the years, that's, man, what a game changer that would be. That would be awesome. This episode of the Evolve Wellness Experience is brought to you by my company, Premier Wellness Centers. If you work actually locally to the Treasure Coast in any organization whatsoever, we're actually starting a new program, which is the corporate wellness programs. We have two components to that corporate wellness. First of all, we do quarterly corporate lectures based upon your industry. And what's fascinating about that is studies actually indicate that when you have regular corporate wellness topics in your industry on a quarterly basis, it can decrease work-related injury by up to 50%, which is a huge thing as it pertains to the bottom line. So if interested, you can contact us directly, premierwellnesscenters.com, and send us a message. You can also call us directly, 772-879-8700. Part B to that, if we come out and do corporate wellness lectures and you wanted to do some type of in-house or out of the practice or business wellness programs, we can also set those up according to your industry and according to the number of employees and such. So once again, give us a call today, 772-879-8700, or contact us online at premierwellnesscenters.com, and let's get some corporate wellness going for your company. So we've got me going on, the protocol and stuff like that in my program that we're in right now. And, some of those are what are called peptides.
Right.
And it's very interesting because, now it's like anything else. They're starting to gain popularity. And now, before there's like a lot of things you used to be able to go into. A good example, used to be able to go into pretty much any gas station, any health food store and get epinephrine. Like tabs and stuff like that, but
right.
Then all of a sudden everybody started turning it into like meth. So then
Correct.
they made that illegal. And the peptides, I remember just a few years back, you could just go on to basically any website and order them online as far as peptides. And now it's starting to get restricted, it looks like, in that regard too, through the FDA. So what exactly are peptides?
So peptides are small chains of amino acids or small proteins, most of them naturally occurring substances, or naturally occurring substances like growth hormone, where they've chopped a little piece of it off, which also has some potential benefits, either from an anabolic standpoint, recovery standpoint. And there are peptides that can do a little bit of everything. Some that can grow your hair, some are good for skin and wrinkles, some are good for sexual function, some are good for body composition, some are good for musculoskeletal health. You name it, there's probably a peptide for it. And again, I think we go back to things we talked about earlier. They tend to work rather well. I think the pharmaceutical industry and the FDA and some of the other things are getting a little bit concerned because of potentially maybe reducing profits and we're healing people instead of them needing medications for 20, 30, or 40 years and that sort of thing. And they're really putting the clamps down on certain ways that these are able to be manufactured and made. They're still available, and hopefully that will continue, but definitely something we'll have to kind of closely monitor and watch. But I
really hate when people actually get well. That's just, isn't that the worst scenario in healthcare?
Yeah, I mean, it's a constant battle as far as that goes. And I mean, we can be as cynical as we'd like to be and And there is a fair amount of truth to it, unfortunately, even in our cynicism. But by the same token, I mean, it had become, like you said, a little bit of the Wild West where, I mean, you could get all of these things wherever you wanted to get them, and they were not regulated at all or very well. And so there is a little bit of the safety piece and some of the other things that I can see their point.
Mm-hmm.
So
Agreed.
we have to balance that to some degree. So I'm not saying they're all wrong as far as their thought processes and those sort of things, but there also is a lot of truth to what we just said.
Mm-hmm. Absolutely. Yeah, so peptides, I think I'm on the BPC 157 right now. That's really good for inflammation and gut health.
Exactly.
For sure.
Really good for musculoskeletal issues. Anybody that's had any type of brain trauma as well, it's actually very good for the reasons that you talked about. It's really good for reducing inflammation, recovery from that standpoint. Mm-hmm. It's one of the go-tos, I think, that most, precision medicine, health optimization, musculoskeletal physicians have looked at. But it's well tolerated. Rarely have I had anybody that's ever had to stop it. The other nice thing is they have not found any type of a lethal or toxic dose to it whatsoever. Mm-hmm. So you can go kind of as high as you need to. Obviously, the price unfortunately goes up, but that you need to try to impact your client or patient in a positive manner. Mm-hmm. There are even some folks that are, injecting it either into joints, soft tissues, or even around nerves for the reasons that it helps to reduce inflammation and some of the other things too. So it too can be done or used in the musculoskeletal realm, similar to the way that some of the regenerative therapies can.
With the injections, I have heard one thing about that. You could give me your insight on it. Better. Some people say, like, as far as like maybe a tendon injury, it's better to inject it into the tendon versus subcutaneous around the tendon. Have you seen a major difference between the two?
I don't tend to use it a whole lot from that way. I mean, if somebody has a desire to do it or, they want to do that before we do regenerative medicine or in addition, I'm good with doing it. I wouldn't say it's the most common way that we tend to use it. Most of the time, it's either subcutaneously or orally, one of the two. Mm-hmm. But some anecdotal, reports, feeling like putting it into the tendon or around it can be of benefit. So, I think it can have a role for sure, but I don't have anything to hang my hat on from a data standpoint, to be honest.
All right. So obviously we spoke about the benefits of gut health in regards to that particular peptide, but overall now there's a I think the concept of the microbiome and its mm-hmm. influence on your overall health and well-being. I mean, there's a lot of functional medicine doctors out there. You listen to their podcasts. I mean, they'll hang their hat on the fact that like that's probably the most important like thing that you really need to do as far as your overall health and well-being is really looking at the integrity of your gut. What's your thoughts on that?
No, I mean, I would agree. I'm a little bit more of a centrist, or I don't tend to focus on one area, is what I'm trying to say. Looking more globally than locally. But I agree. I mean, it's definitely a big, important piece. But could I say it's more important than sleep? Is it more important than stress reduction? And they're all intimately tied together. No, but, it's definitely a big, big piece that definitely needs to be addressed, I would say, in the vast majority of folks and people, whether they've got, reflux, constipation, diarrhea, chronic infections, abnormal gut flora, all the other things associated with that. Because if you're not able to digest, absorb, assimilate all the other pieces associated with that, then yes, you're going to be a bit of a mess, to be honest with you. So yeah, I mean, I definitely think optimizing that is incredibly powerful and important. But there are others that I probably feel are along the lines of that. And again, I try to look at it more as a global entity as opposed to, hey, if we fix your gut, everything else is going to be peachy keen and rosy. But definitely a big part of overall health and longevity and recovery and anti-aging and all the things associated with that as well.
Yeah, I mean, what I actually see a lot of times too, and just in regards to gut health and such, is a lot of people have like leaky gut symptoms. For sure. I mean, the the antibiotic abuse that goes on just from childhood, and clear viral infections, and they're going in and here's your antibiotics for a viral infection and all that stuff,
Right.
And then ear infections and all the such, and then we have all the the pesticides in our food sources, and they're breaching and we have all these autoimmune disorders, inflammatory responses. It's like food sensitivity. I mean, allergies. Like, I don't ever remember when I was in school, like kids having like all these allergies. We had to ask, what is it okay that you have any food allergies that we should be aware of before we serve you, lunch in school? And it's crazy. So, but
No, I would agree with you. And it gets harder because the testing's okay. It's just not, in my opinion, where it's going to be moving forward. I do think we're going to have much better availability for defining and helping even more than what we're doing. And we've definitely made significant strides, don't get me wrong, because it used to be, I mean, you said, similar to what you said, you say leaky gut to somebody, they'd be like, what the hell's that? Or they didn't believe it. And again, it's been fully documented in the medical literature, and definitely as an entity that is definitely problematic. And I agree with you. I mean, if we're looking at autoimmune health and that sort, I think that absolutely, you've got to address the gut. There's no two ways about that, 100%. But yeah, I mean, it's definitely an issue or an entity that definitely needs to be addressed and asked about in your initial, discussion and or interview, and trying to elicit all potential issues. Because some people say, oh, my gut's fine. And you start talking to them, and they start telling you, yeah, well, I kind of bloat here and there if I eat X, Y, or Z. And yeah, I'm constipated 3 out of 7 days of the month or week. And then I get diarrhea, and then, I can't tolerate it, this. And yeah, I mean, it's definitely a piece that if you can get online, it's going to do nothing but help you moving forward.
No doubt about it. One of the cornerstones for sure, no doubt. But yeah, like you said, sleep, exercise, all the other lifestyle habits and things like that are just as equally as important. Gut health is definitely just one entity of that. So talking about Liv Health, tell us a little bit about the company and how'd you get involved with them?
Yeah, so I started talking with Andrew Wax, who is one of the concierge coaches there, and I believe also part in the executive team. Just before COVID started, probably early 2020, I think he was on a podcast I had listened to, and I was like, this is interesting. So I, wrote into him and had a discussion interview with him and said, look, I'm really interested in kind of what you're looking to do. And, COVID hit, and they got kind of pushed back a little bit with their launching and opening and that sort of thing. Probably really got going with them early mid 2021, and has slowly grown to the point where I'm pretty busy with clients. And basically their goal is not necessarily to do primary care or normal colds and that sort of thing. It's really to kind of take folks that are looking to take their health to that next level, kind of transform and look a little bit deeper into data, including blood work, including potentially genetic testing, including body composition analysis like a DEXA scan. If you have a wearable device like an Oura Ring or a Garmin watch or a Whoop or a BioStrap, and put that all together into a process and plan to meet the goals, and whatever those goals may be. Again, similar to what we talked about earlier, I have some that just want to really focus on having the ability to play with their grandkids. I have other people that are, relatively high level marathoners and or triathletes that, hey, I really want to improve my time. I want to drop 10 seconds here or there, or whatever that number may be. Or I want to be on the podium. I have some of them kind of in the senior levels that are very competitive and are like, look, I'm tired of getting beat and I want to be on the podium. And there's all gamuts in between. Other people really focused on their brain health. They've got a family history of Alzheimer's. They're like, okay, what can I do to make this not happen to me or mitigate the effects? So basically, we get all that information together. The concierges meet with the client first, kind of gather the information. They take that information and we order a blood panel. And after the blood panel's in, everything's together. They meet with a doc, and then we review all that information. Typically, I spend about an hour with the client the first time, kind of going over their ideas, kind of my gestalt, kind of the way I process and plan, how it's going to be more of a long-term solution as opposed to something in 45 to 90 days where you're going to be cured, and come up with a plan of attack to try to make that happen, with the understanding that it's probably going to take us anywhere from about 6 months to 24 months to really get things optimized. And there's probably going to be some bumps in the road. There's probably going to be some setbacks, but the goal is, if we have to take a step or two back, hopefully we can take 4 or 5 forward to kind of get you where you need. Usually I tell folks it should be like the stock market. It should go this way, but some days you're going to do really well and other days you're not going to do so well. But as long as we're going this direction, that's kind of what we're shooting for.
Absolutely. And the platform is I was so impressed with the platform, like you said, because, you have these apps. I have an Oura Ring, that obviously tracks my sleep patterns and my steps and my calorie expenditures and all heart rate. And now it's checking oxygen saturation rates at night to see maybe if you have apnea or something else.
Sure.
That is interfering with that. And then but then I track all of my calories and my macros and everything I do dietarily on MyFitnessPal, right? And so constantly I always have thought, I'm like, man, wouldn't it be cool if a place that you could just basically have a board and up on the thing, and all your metrics would be within that in one place instead of going back and forth, and you could really chart that. And I didn't even know that was part of the program. So when I literally got into the platform and logged in and I saw that you could link up all these different applications that I was already using, I was like, holy cow. This is exactly it, man. It's so cool. So now when I log in every single day and I just look at my patterns, it's nice to be able to see that what we're doing, from a supplementation standpoint and protocols that we're putting into place, how that's paying dividends on my sleep efficiency. Because my sleep efficiency, was 76, 77% and stuff. And now I just looked and it was at 86%. So it's improved I'm not waking up and not moving as much. I got up almost 2 hours of deep sleep the other night. If I would get sometimes 35 minutes of deep sleep, I would be like, wow, that was a really good night deep sleep. I feel so refreshed today, So it's really nice to have that, all in one platform as well. And the other thing I would say about the process that I was impressed about, and I think it's important for listeners to understand, is that when you get your blood work done and you're within your normal, right? Normal, in blood work is you're in the average of the worst that exists, that they accept as the worst in the nation and the best in the nation, right? And Correct. As long as you follow within those, that's normal. But a good example with me is, I said, sometimes I kind of hit that classic wall that people always talk about 3, 4 in the afternoon, and I might get a good night's sleep, but I kind of feel not super energetic. And you looked at my thyroid levels and you said, well, your free T3 looks good, but it's not optimal. So, Correct. You're at a 4. Why don't we get it to a 5? And we'll take the supplement to bump that up a little bit and get your thyroid levels up to a 5, and then that's going to improve your energy. It's going to improve your body composition. Your metabolism is going to improve, because I'm 46, and I hate to admit it, but my metabolism slowed down. I don't recover as quickly as I used to from my workouts. So, our protocol for me right now is recovery, energy, body composition, all those things, because I said, my goal is I really want to recover, have the metabolic capacity that I had when I was in my 20s. Not in my 40s. So that's my protocol. I want to get back to 25. So it's awesome.
Yeah. And that's kind of, you explained it well, is the goal around where our peak hormone levels should be, around 18 to 25. Now, unfortunately, with some of the things we talked about earlier with environmental toxins and heavy metal issues and bad diets and limited exercise patterns and certain things, I'm seeing more and more younger males and females that are having significant issues, even in their teens and early 20s, which is another area we could talk about maybe in another podcast. But normally, that's what I'm trying to do, is get people where their hormones were about 18 to 25. And again, as you said, if you look at quote unquote normal, That's about 95% of the population, ranging anywhere from 18 to however old people live to, could be in the hundreds. And, I'll give you a quick example of why that can be problematic. They've looked at testosterone levels starting in the 70s, and the free and total normals have dropped every 10 years since the 70s. So it used to be kind of normal total was in the 1200s and normal free was 50 some. And that number has continued to steadily dwindle to the point where it's 2/3 of what it used to be, somewhere along those lines. I can look up the numbers, but
wow.
The point is that's changing negatively, and our quote unquote normal is becoming less and less, which unfortunately then insurance companies and some of the other folks are using as the standard bearer of what's considered normal or abnormal, whereas it's not really where it should be. It's more the clinical piece. Yes, the numbers help me, but it's not the end all be all. If you're 200, you're good. And if you're 201, you're fine. Or the other way around. If you're 201, there's no issue. If you're 200 or 199, there's now a problem. No, it's more along the lines of things you talked about. Boy, my focus is not where I'd like it to be. I've got a bit of brain fog. My energy's not where I want it to be. My libido is gone to hell. I can't recover from activity and exercise like I used to. Those type things. And, again, I would tell folks in this and some of the other entities I work with, this is much a clinical diagnosis as it is a number type thing. So it helps to guide me, but it also, I want to talk to you and get your perspective. I mean, if we don't get you up to optimal levels, but you come back and go, damn, I feel great. Okay. Then that's where we need to put you, because again, the art of it comes too in the fact that people metabolize their hormones differently. So if your levels are a little bit lower, but you feel good, suggests to me that things are hanging around a little bit longer to do the job, and you're not breaking them down as quickly. So they're able to, cause the effect that we're looking for. Whereas you do have some folks that are on the other end of the spectrum. They metabolize stuff very quickly, and it's not able to hang around and do the job as it should be. So sometimes we have to drive their levels a little bit higher, similar to what you talked about with your thyroid. And sometimes we can glean that information from other testing, like your genetics and, Dutch tests and some of the other things from that standpoint too.
So fascinating, man. What the human body is just a miracle, man. It's such a complex and amazing machine for sure, and that's why it's called the art of practicing medicine, because it's just if you claim to know it all and have mastered the process, you don't even know what you're talking about for the most part. That's for sure. So
ever evolving, you're right.
No doubt about that. So if our listeners, want to check out Liv Health and stuff like that, what's the best way that they can go about finding out about the company and getting hooked up with the doc?
Yeah, just get on www.livhealth.com, and it will allow you to, enter your information, and someone can get back to you if you're trying to gather more, or if you're like, yep, this is what I want to do, then you can go ahead and sign up, and we'll get the ball rolling with your initial interview and or getting the blood work and some of the other pieces associated with that. It's pretty seamless, as you have noted, pretty easy to do. And they're pretty quick and nimble to try to get back to you and get things moving forward. The one thing that is necessary, however, is you have to have a primary doctor, and you have to have documented evidence that you've seen your primary doctor within the last year. So that's one of the big pieces that we focus on, both from a medical standpoint, but also a little bit from a medical legal standpoint, just to make sure that everything's on the up and up. You've been given the stamp of approval that there aren't any major issues, concerns with your health, and that we're able to kind of move forward. And along with that, we do the intake information both with the concierge and or with the doc. And then we also use that information along with the labs and some of the other data pieces to really come up with a good but safe program for you to really try to meet your goals.
And all this, by the way, is completely virtual. So it's not like you have to go to like a brick and mortar, like regular doctor's office, other than the fact that you got to go get your blood work done and such like that. But you'd also mentioned too, in the event that part of the protocol and stuff you come up would be some type of intervention with an injection or PRP or something like that, then do you have kind of like satellite practices that you're affiliated with in areas to go to?
my day job, I work with a group called the Osteopathic Center, which has locations in Miami, Florida, and Knoxville, Tennessee. So that's where I do the vast majority of my work from a regenerative medicine standpoint.
Mm-hmm.
And then we also do things like ozone therapies, which are very good for people that have chronic infections or illnesses, but also for people that are just looking for a boost from a general health standpoint.
Mm-hmm.
We do a lot of IV therapies there. We also do aesthetics and sexual health type treatments, which we use PRP and some of the bone marrow treatments for as well. But we do a little bit of everything. I also do some of the precision medicine health optimization things there. My partner focuses more on chronic illnesses like mold and Lyme and heavy metal toxicities and some of the other things too. So we hit it both from the ill standpoint, but also from the health optimization standpoint. So we have a little bit of everything covered.
Mm-hmm.
The website for that is www.theosteocenter.com.
Awesome, man. Well, Dr. Michael Meighen, it was a pleasure to speak to you today. I'm sure I'll be talking to you and seeing to you real soon as I kind of make my way through my journey. Obviously, I'm working and optimizing my health and well-being. And we'll have you back on for another show down the road and we can get into some more stuff.
Sounds great, Bill. I really appreciate it and really enjoyed the conversation.
All right. Enjoy the rest of your day. I'll talk to you soon.
You as well.
Thank you.